The best part of the journey is I'm happier. I understand myself now. If I had to do the surgery again, I will do it 100%.
I have so much more energy right now. I actually have a lot more confidence. I'm much more outgoing now.
Just being happy and looking in the mirror and being able to smile for the first time is one of the best things.
Every day is a challenge in many ways, but by being successful through this program, I have been able to step up to those challenges. I just thank God for pointing me in this direction. I sincerely thank Hahnemann for their blanket of care and love.
Hello, and welcome to the online seminar for the Center for Surgical Weight Loss at Hahnemann University Hospital. We are a multidisciplinary bariatric surgery center located in the heart of Philadelphia, Pennsylvania. The goals of this seminar are to introduce you to our center, to define the disease of obesity, to briefly go over non-surgical treatment options, to educate you about surgical weight loss procedures, discuss risks and benefits, explain who qualifies for surgery, and briefly describe the requirements for surgery. You will also see and hear from real-life patients throughout this forum. We are honored to have you join us. First, a little information about our center. We are a multidisciplinary surgical weight loss center located at Hahnemann University Hospital in Center City, Philadelphia. Our program team includes fellowship-trained surgeons specializing in minimally invasive surgery, a registered nurse, a medical assistant, and a registered dietitian, all of whom work together to coordinate the care of the bariatric surgery patient. We also work closely with the internal medicine physicians, pulmonologists, cardiologists, clinical psychologists, and gastroenterologists involved in evaluating potential patients. Our center has been providing care in bariatric surgery since 2008. We are fully accredited by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. As a comprehensive center, the MBSAQIP is a joint venture between the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery. This accreditation formally acknowledges our commitment to providing and supporting quality improvement and patient safety efforts for metabolic and bariatric surgery patients. As an accredited center, we have demonstrated that we meet the needs of our patients by providing multidisciplinary, high-quality, patient-centered care. For a brief introduction to our surgeons, please visit our homepage and view our Meet the Surgeons videos. Now, we will define and discuss obesity as a disease and talk about what qualifications need to be met in order to be a candidate for weight loss surgery. According to the Centers for Disease Control and Prevention, overweight and obesity are both labels for ranges of weight that are greater than what is generally considered healthy for a given height. The terms also identify ranges of weight that have been shown to increase the likelihood of certain diseases and other health problems. The American Society for Metabolic and Bariatric Surgery defines obesity as a disease in which fat has accumulated to the extent that health is impaired. Obesity is a complex, multifactorial, chronic metabolic disease, not just an excess of adipose tissue or a lack of willpower. It is a disease influenced by many interconnected factors, such as genetics, environment, behaviors, psychological profile, physiology, and metabolic factors. It is measured by the body mass index, or BMI. The BMI is the medical standard for measuring the presence and degree of obesity. The BMI is a ratio between an individual's height and weight that is associated with body fat and health risk. Bariatric or weight loss surgery is for patients who are severely obese, which is defined by a BMI of 40 or more, or a BMI of 35 or more in combination with other health-related conditions called comorbidities, such as diabetes, hypertension, or sleep apnea. These are a few of the comorbidities associated with obesity, although there are certainly more than listed here. Other than the ones just mentioned, some of the more common comorbid conditions are polycystic ovarian syndrome, hyperlipidemia or high cholesterol, arthritis of the weight-bearing joints, infertility, and urinary stress incontinence. Did you know? 1/3 of the U.S. adult population is considered obese, and that number is growing. Test your knowledge with our weight loss quiz. What factors can contribute to obesity? A. Genetics. B. Behaviors. C. Your environment. Or D. All of the above. The answer when we return.
I was 54 years old. I had high blood pressure, high cholesterol, acid reflux disease, sleep apnea, was depressed. I was very, very unhappy in my life. And as soon as I went to Hahnemann, I can't tell you, but there was just this blanket of love that was loving care that was just placed upon me. I am 6 years and 7 months out of surgery. And I can tell you very frankly that I am just a very happy camper today. I have much more confidence. Prior to surgery, exercise, somebody would mention, oh, let's go for a hike, let's go for a walk even. I was just, I'm gonna break a sweat, I'm gonna be, inhaling and just so tired, and I just didn't want to even entertain that thought. Yet today, someone says, let's go for a hike, let's do a Zumba class, I'm there. Every day is a challenge in many ways, but by being successful through this program, I have been able to step up to those challenges and realize that I'm constantly learning. And I just thank God for pointing me in this direction. I sincerely thank Hahnemann for their blanket of care and love.
What factors can contribute to obesity? The answer, D, all of the above. Now, let's briefly explore some of the non-surgical options available to treat obesity. Surgical treatment should be reserved for those patients who have tried conventional weight loss methods without success. The recommended treatment for obesity typically depends on the severity of the disease, as shown. Lifestyle modifications and pharmacotherapy are important tools in the care of the obese patient and should always be attempted before surgical intervention. More often than not, however, these methods of treating obesity are not enough to attain the necessary amount of sustained weight loss to achieve the long-term health benefits, and surgery should be considered. And now, let's introduce the surgical procedures we perform to treat obesity. We're going to focus on the two most commonly performed procedures in the U.S., the sleeve gastrectomy and the gastric bypass.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested.
The amount of weight loss experienced after bariatric surgery is usually expressed as a percentage of your excess body weight. In other words, a percentage of how many pounds overweight a patient is relative to standard norms based on age, height, and gender. Bariatric surgery is by far the most effective way to achieve meaningful, long-term weight loss. You can see a comparison of the average weight loss amounts by surgery type here. This can be compared to behavior modifications and medical treatment, which averages 5 to 10% of excess body weight loss. Bariatric surgery is recognized by many professional organizations as the most effective treatment for morbid obesity. In fact, many leading associations in the U.S. have developed position statements supporting bariatric surgery for certain patients, including the American Heart Association, the American Diabetes Association, and the Society of American Gastrointestinal and Endoscopic Surgeons. Test your knowledge with our weight loss quiz. What is the excess weight loss average for gastric bypass surgery? A, 5 to 10%, B, 20 to 30%, C, 50 to 60%, or D, 60 to 80%? The answer when we return.
Prior to surgery, I had high blood pressure, diabetes, I had sleep apnea, and I have hypertension. I was overweight. I was almost 410 pounds. I was in a really bad situation of depression. The first time I visited the Dr. Castellanos and the Hahnemann group with Carolyn and the nurse practitioners, they treated me like I was a human being. I was not treated like I was overweight. I came to them in one of my lowest time in my life. And from that point on, I decided to make a change. And the best part of the journey is I'm happier. I understand myself now. One of my aha moments after the surgery is looking at myself in a different way. I see myself healthier. I can do things that I have never done before. Going to the gym, running, and being healthier. If I had to do the surgery again, I will do it 100%, without any doubt. And the group of people that I will come, it will be to Hahnemann Hospital.
What is the excess weight loss average for gastric bypass surgery? The answer, D, 60 to 80%. Next, let's look at the benefits of bariatric surgery. As we've stated before, bariatric surgery achieves the highest average weight loss by far compared to diet modification and exercise. Due in part to the large degree of weight loss and due in part to the metabolic changes caused by the procedures, bariatric surgery results in the best percentages of comorbidity reduction and resolution. In other words, the best chance for resolving or reducing weight-related diseases, such as diabetes and hypertension, among many others, is through bariatric surgery. And here we can see some more examples of common comorbidities related to obesity. Along with the disease, we also see the percentage of resolution and/or improvement after bariatric surgery. For example, patients who have received bariatric surgery have had their diabetes improved in over 85% of cases. And of the bariatric surgeries, the gastric bypass is the surgery most likely to put your diabetes into remission. Several other diseases can be seen here as well, such as hypertension, arthritis and pain of the weight-bearing joints, polycystic ovarian syndrome, migraine headaches, and obstructive sleep apnea. Overall quality of life is improved in 95% of bariatric patients. It has also been shown to greatly reduce the risk of death due to obesity. These surgeries result in tremendous health benefits to patients along with long-term sustainable weight loss. So, what are the risks of bariatric surgery? The risk associated with bariatric surgery is extremely low. One study finds that it is now as safe as common procedures, such as gallbladder surgery, appendix removal, and knee replacement. In fact, the American Heart Association, the American Diabetes Association, and the Society of American Gastrointestinal and Endoscopic Surgeons all advocate for bariatric surgery as a long-term treatment for obesity. Gastric bypass is also the option most likely to put diabetes in remission. The average hospital stay after bariatric surgery is only 1 to 2 days, and based on your occupation, the average time away from work after surgery can be as little as 1 week, but typically we recommend 2 weeks. Test your knowledge with our weight loss quiz. True or false? The risk of bariatric surgery is no higher than other common procedures, such as gallbladder removal, appendectomy, and knee replacement? The answer when we return.
I had hypertension that I was on a medication for. I had high cholesterol, which I was taking medication for, and I was borderline sleep apnea.
I had polycystic ovary syndrome. I wasn't on medication for it, but I was going down the path of getting on medication for it. I was also suffering from a lot of migraines, just taking over-the-counter Excedrin, but I was going to need medication for that sooner or later.
I have so much more energy right now. I actually have a lot more confidence. I'm much more outgoing now.
I always had the big personality, but it just got bigger, unfortunately.
Hahnemann has been very supportive of us. They have great follow-up. The staff is very caring. They really pay attention to your needs, and they follow up with everything.
Yeah, Hahnemann, the workers there they become your second family through this process. The day after surgery, I just remember them coming to visit me, even though I know they didn't have to, but it just shows that they really care for you and your health. The surgeon came and he sat down and talked to me to make sure I was doing okay. My life has gotten a lot better since the surgery. I'm more active, going to the gym. I still don't like it, but I go. Best part of the weight loss journey for me is the shopping. I'm not gonna lie, I love the shopping. Being in the skinny girl store or the normal store and not having to go to the plus size is amazing. I'm happy. Just being happy and looking in the mirror and being able to smile for the first time is one of the best things.
The risk of bariatric surgery is no higher than other common procedures such as gallbladder removal, appendectomy, and knee replacement. The answer? True. So what are the next steps? If you're interested in more information, you may register to attend one of our live seminars by calling 215-762-7070. Or if you're ready to begin your weight loss journey, please contact our office at 215-762-7070, where you will speak with a member of our service team to complete your registration. You will need to provide your insurance information so that we can verify your benefit for bariatric surgery. Once the benefit verification is complete, we will contact you to schedule your first appointment. At your first appointment, you will meet with your surgeon who will evaluate your medical conditions and history to determine whether you are a good candidate for weight loss surgery. Your surgeon will also discuss surgical options and answer any medical questions you may have. Following your initial appointment, you will begin the pre-operative process, which will include a pulmonology, cardiology, and psychological clearance, as well as dietary counseling and attendance at a minimum of 2 of our supportive group meetings. This may seem a little overwhelming, but you will not be alone in this. We will be here to help, and we will be with you every step of the way. At the Center for Surgical Weight Loss at Hahnemann University Hospital, our mission is to give each patient the guidance, education, and support they may need to achieve optimal success. We measure the success of our program not by the amount of weight our patients lose, but by the improvement of the quality of our patients' lives. The surgery itself is only one component of a successful treatment plan. While it will certainly help you lose weight, you must continue to work hard through exercise, dietary, and lifestyle changes to obtain the maximum lifelong benefits of the surgery. Until now, you may have struggled with the physical, medical, emotional, and social ramifications of obesity. Bariatric surgery may signify the beginning of your healing process in these areas. Our patients learn what it is like to feel better and have improved health, and the surgery gives them a tool to reinforce the positive lifestyle changes they are ready to make. We also offer support groups, which are an integral part of maintaining this commitment. Join our growing number of people who have made the decision to change their lives. Thank you very much for your attention. We hope to meet you soon and help you begin your journey to a healthier you.